Hi, I'm Dr. Kurt Wohler. The title of this Autism Biomed Essentials video is an unusual cause of aggression in autism. So this video is sponsored by autismrecoverysystem.com, which is a comprehensive biomedical information and educational website specifically designed for parents and caregivers with loved ones with special needs that would include autism and other autism spectrum disorders. For more information, you can go to autismrecoverysystem.com or email us at autismrecoverysystem@gmail.com. Within the Autism Recovery System website, there are many sections, resources, videos, articles, as well as a member forum where questions can be posted directly to me. There is also a very comprehensive biomedical course, a 6-module course called Autism Biomed Essentials. This is our disclaimer. Understanding the information within this video is for educational purposes only. So with regards to biomedical intervention, what we also call integrative medicine, or you could flip that around, integrative medicine could be considered biomedical intervention for autism. We know that there are a number of issues that individuals are dealing with, and many comorbid conditions as well, whether that's gastrointestinal problems, allergies, headaches, etc. And so from an autism assessment, from a biomedical intervention standpoint, there's a number of different lab tests that are done looking at different signs and symptoms of issues as well. Now, I developed something called the 4-pillar approach many years ago in the initial foundational implementation of biomedical intervention. The first pillar is dietary intervention, whether that's a gluten casein-free diet, specific carbohydrate diet, etc. Because we know that a whole food, real food diet is very important for these individuals. And then the second pillar is foundational supplements. Now, there's many different supplements that can be used in autism, but foundationally, we're incorporating vitamins, minerals, essential fatty acids, in essence, to fill in those gaps nutritionally, which is often occurring. Digestive system assessment is a major factor, looking at fungal issues, bacterial problems, parasitic infections, inflammatory issues, another major area. And then the fourth pillar is methylation problems, which would be things like B12 and other types of supportive supplements. And so those are the basic 4 pillars that we're always looking to review and incorporate for any individual on the spectrum. Now, there are many other interventions as well. The other intervention box that you see here, this could include, looking at hyperbaric oxygen therapy or antiviral therapy. So there's a myriad of things that would fall into this other intervention section. But what I wanted to present in this video is an unusual cause of aggression in autism. We often think that the cause always has a biomedical issue, whether it's food sensitivity or gastrointestinal problems and whatever. And this was an interesting case that we'll get into here. But one of the things to remember about aggression and self-injurious behavior in autism is try to figure out what might be the trigger. Is it a continuous problem or is it intermittent? Is it situational, meaning does it only happen at school, or does it happen with a certain neighbor or therapist, or what is it that seems to trigger that behavior in your child? Not every problem is related to a medical issue, but many are. Okay, dietary intervention issues or dietary sensitivity problems can be a big issue. So wheat sensitivity, dairy sensitivity, perhaps it's too much sugar, it could be artificial colors or flavors. Okay, all of these things can be a contributing factor. And then physical pain, constipation can be a trigger in some kids, headaches as well, body pain, which sometimes is difficult to figure out. Now, we know that things like oxalate accumulation that causes inflammation of the body can lead to pain, and that can clearly be seen in some individuals with autism. One of the things that we like to do is something called the organic acid test. that helps to analyze for different bacterial toxins. And then again, looking at gut inflammation, comprehensive digestive stool test, and as I mentioned, constipation can always be an issue as well. So this was a case of a 7-year-old boy that I consulted with. His age of autism diagnosis was at the age of 2, and most of his issues were around speech. He had poor social interaction, poor social interest, a lot of self-stimulatory behavior. Now, prior medical issues was projectile vomiting episodes that started around the age of 1, and they suspected that he had reflux. He was actually put on reflux medication. And he also had a lot of feeding issues, so generally fussy and a picky eater. But a lot of the behavioral issues intensified around the spring of that year, where he started headbanging, biting his hands, and got very aggressive, particularly around mealtime. Now, the aggression occurred shortly after the family had moved from Texas to Kentucky. And they also noticed he was having allergy symptoms, so itchy eyes, runny nose, sneezing, etc. He was prescribed Zyrtec from a local doctor, and that provided some relief with regards to his allergies, but he continued with aggressive behavior associated with meals. Now, he was eventually referred to a pediatric gastroenterologist who performed an endoscopy and discovered a condition called eosinophilic esophagitis. And this is where eosinophils, part of the innate immune system, infiltrates into the esophagus and can cause inflammation. And so he had this intraepithelial eosinophilia, so large amounts of eosinophils infiltrating the last part of his esophagus. And this causes a lot of pain. In fact, his situation was quite significant. So he was actually placed on Zantac, which is an acid blocker, and a restricted diet. And it helped tremendously. In fact, over about a 3 to 4 month period of time, his bowel issues, or I should say his aggression behavior, diminished by about 80% within 2 weeks of his initial therapy and a change in his diet. And within 1 month, there was really no more issues. And so for the first time, he had typical eating behaviors. And so we often, again, think that it's always going to be this sort of common scenario linked to gluten intolerance or lactose intolerance, or it might be yeast or a bacterial problem. But it is appropriate at some point to actually sometimes get a referral and undergo some type of diagnostic procedure like this child had, where they did what was called endoscopy to try to figure out the problem. And so this was a truly a medical problem. It wasn't that it wasn't biomedical, but it was really a medical issue that needed to be handled by a gastroenterologist and eventually resolved through using acid blocking medications. Now, long term, that's not something that would want to be on, ideally, because that can have its own issues. But it really kind of shows that sometimes behavioral issues in individuals like this can be triggered by underlying inflammatory conditions that need medical diagnostic procedures. So again, within the Autism Recovery System website, there are many sections that are educational based, from articles to videos. There's also a very comprehensive biomedical course called Autism Biomed Essentials. And so please check that out. If you have any questions, you can email us at autismrecoverysystem@gmail.com. Again, I'm Dr. Kurt Wohler. Thank you.